Every week, countless men, perhaps even you, are unknowingly damaging their penis through seemingly harmless habits. These are private routines, rarely discussed, yet they can lead to pain, scarring, and even permanent dysfunction over time. I'm Dr. James Ellison, board-certified urologist and men's health specialist. For more than 30 years, I've helped men across the United States, especially those in their 60s, 70s, and beyond, preserve their sexual health, maintain function, and enjoy a better quality of life. Masturbation is widely believed to be completely safe, and in many cases, it is. But after age 60, your body isn't the same. Your skin becomes thinner, your blood vessels more fragile, your hormones shift. What was once harmless at 25 can pose real risks at 65. Are you unintentionally putting yourself at risk? In this video, I'll uncover the 4 most common masturbation mistakes older men make and explain how these habits can lead to long-term complications if left unaddressed. I'll also walk you through safe, practical alternatives you can begin using today to support lasting penile health and performance. Mistake 3? It's one I encounter nearly every week in my clinic. And unfortunately, by the time most men bring it up, they're already dealing with pain, discomfort, or performance issues. If you care about protecting your body and staying informed as you age, subscribe and turn on notifications. I provide honest, practical, no-nonsense advice tailored specifically for men like you. Because knowledge is power, especially when it comes to your health. And if this video speaks to you, type 1 in the comments. If not, type 0. Your feedback helps me serve you better. As you age, your body doesn't respond the way it used to. Blood flow reduces. Skin becomes thinner. Erections may take longer and require more stimulation, but these changes also make you more vulnerable to injury, irritation, and long-term problems. If you're still enjoying self-pleasure, and you absolutely should if it's part of your healthy routine, you must adapt to the changes your body is going through. Let's look at the 4 mistakes I warn every older man about. Mistake 1. Using too much pressure or aggressive motion. Let me be very honest with you. This is the #1 mistake I see in older men, and it's one of the most damaging. I've had patients, strong, independent men in their 60s and 70s come into my office frustrated and scared. They're dealing with pain, unusual bending, or sensitivity loss, and they don't understand why. And when I start asking questions, it turns out the issue often started with something they thought was harmless: the way they masturbate. As men age, sensitivity begins to decrease. You may not feel aroused as quickly, or the sensations may not be as intense as they once were. That's perfectly normal. But many men respond to this change by increasing the pressure. They grip harder, stroke faster, or even use household items or intense devices to chase the feeling they remember from their youth. What they don't realize is that the aging penis is not built for that level of intensity anymore. The skin becomes thinner, the blood vessels more fragile, the erectile tissue less forgiving. When you apply too much pressure, especially repeatedly, you risk doing something most men don't talk about until it's too late. Structural damage. Tiny tears in the tissue may seem like nothing at first, maybe just some redness, a little soreness the next day, but over time, those micro tears can build up into real scar tissue. That's how Perion's disease develops, a condition where the penis curves painfully during erection. I've seen men break down in tears over it, ashamed to talk about what's happening and unsure how to fix it. And here's the scary part. Most of this damage is preventable. All it takes is adjusting your approach. You don't need to force pleasure. In fact, the harder you chase it, the more likely you are to push your body past its healthy limits. Masturbation should be an act of connection with yourself, not punishment. If you've ever noticed bruising, bending, or lingering pain after masturbation, take that seriously. Don't brush it off. That's your body asking you to stop before it causes long-term harm. Change your technique now before damage becomes permanent. But this isn't the only habit putting you at risk. There's another mistake surprisingly common among older men that seems small, but can silently do even more harm over time. Let me show you what it is and why it's the next thing you must avoid. If you're still here and this message is resonating with you, go ahead and type the number 1 in the comments to let me know you're still with me and committed to taking better care of your health. Now, let's keep going and take a closer look at the second mistake. Mistake 2. Dry masturbation, not using lubrication. This one might surprise you, but it's far more serious than most people realize. In fact, not using lubrication during masturbation is one of the most overlooked causes of penile injury in older men. And I'm not speaking hypothetically.
I've seen firsthand the long-term damage it causes. A few years ago, I had a patient in his late 60s, active, sharp-minded, still enjoying a healthy sex drive. But he started to notice a burning sensation after masturbation, redness, irritation, even small tears on the skin. He assumed it was just dryness or age, maybe even a mild infection. But the real culprit, he had been masturbating for years without any lubrication, just skin on skin, believing that was normal and harmless. But after 60, your skin simply doesn't have the same elasticity, hydration, or resilience it once had. The natural oils that once protected you, they're not as plentiful.
That means every stroke without lube is creating friction, microscopic abrasions, irritation to the urethral opening. In some cases, even damage to the nerve endings that are vital for pleasure. And worst of all, most men don't notice until that sensitivity starts to fade, until they're no longer enjoying the act like they once did. I've treated men who lost sensation in areas of the penis, not from a disease, but from years of repeated dry stimulation. Some even developed painful conditions like lichen sclerosis, a skin disorder that can cause scarring and tightness. Others unknowingly inflamed their prostate from the tension and strain that built up over time. It's such a simple fix and yet so often ignored. Using a good quality water-based or silicone-based lubricant can completely change the experience, not just making it more comfortable, but protecting your skin, your nerves, and your long-term sexual health. Never rely on spit or lotions not meant for intimate use. Your body deserves better. Think of it this way. If you wouldn't rub dry sandpaper on your hand every day, why would you treat your penis with less care? But lubrication is only one part of the equation. There's another mistake men make that's even more dangerous because it tricks you into thinking nothing's wrong, even as your body sends you clear warning signs. And ignoring those signs could cost you dearly. Let's talk about that next. Mistake 3. Ignoring pain or discomfort. I can't tell you how many times I've sat across from a man in his 60s or 70s, and when I ask about any discomfort or pain during masturbation, he shrugs it off, says something like, "It's just a little soreness," or "It goes away after a day or two." That mindset, the habit of brushing off what your body is trying to tell you, is one of the most dangerous mistakes you can make. Pain is not something to ignore, not at this stage of life. When you were 25, maybe you could push through it and bounce back the next morning. But after 60, your body doesn't recover the same way. That sharp sting, that lingering soreness, that burning sensation during or after ejaculation, those are warning signs. They're your body raising a red flag telling you something isn't right. And when you ignore that signal, you open the door to real, sometimes irreversible damage. I had a patient once, mid-60s, still sexually active, still independent. He came to me complaining about a burning feeling after climax. He thought it was just old age catching up.
But after a thorough exam, we found inflammation in the urethra and signs of nerve irritation likely caused by years of aggressive stimulation and dismissing the discomfort. Had he come in earlier, we could have intervened before the damage settled in. Sometimes the source is the prostate, inflamed from excessive tension or technique. Sometimes it's micro-trauma to the nerves that line the penile shaft. Sometimes it's scar tissue forming slowly, silently, over years of ignoring those quiet signals. The truth is, pain is never something to just accept. It's a message. And at this age, that message is louder and more urgent. Here's what I tell every patient over 60. If it hurts, stop. Period. Pain is not something to tough out. Don't treat it like a badge of manhood. Listen to it, respect it, and if it happens more than once, talk to your doctor. The longer you wait, the more complex the problem becomes. But even when there's no physical pain, there's another silent danger that affects far more men than you'd think. One that slowly rewires your brain, your pleasure response, and your ability to perform with a partner.
It doesn't hurt physically, but the damage it causes is just as real. Let's talk about it next. If you're still watching and finding this information valuable, type the number 1 in the comments to let me know you're staying engaged and taking your health seriously. Now, let's move forward to mistake number 4. Mistake 4, using porn as the only stimulus. Now, this one might not sound physical at first, but make no mistake, it is. And the damage it causes can be just as real, just as lasting as a physical injury. I'm talking about the habit of using porn as your only form of stimulation. It's one of the most common mistakes I see in men over 60, and sadly, one of the most misunderstood. Let me be clear. I'm not here to shame anyone for watching adult content. That's a personal choice. But the problem begins when your brain starts relying on it. When it becomes the only way you can feel aroused, the only trigger that gets your body to respond. And after 60, that dependency becomes even more dangerous. Your brain and your penis are deeply connected through a delicate system of nerves and chemical signals. As we age, our dopamine system naturally slows down. It takes more stimulation to feel the same pleasure. And if that stimulation is coming exclusively from high-speed, high-intensity porn, your brain begins to adapt. It starts needing that level of intensity just to feel anything. Over time, this can rewire the way you experience arousal, making it harder to get or maintain an erection with a real partner or even by yourself without a screen. I've had men come to me devastated saying, "Doctor, I just don't feel anything unless I'm watching something extreme. I can't connect with my partner anymore. I feel broken." And I understand that pain. It's not just physical, it's emotional. It affects your confidence, your relationships, and your sense of manhood. The worst part, it happens so gradually that most men don't realize it's a problem until it's deeply ingrained. What's happening is real. It's called porn-induced erectile dysfunction. It's a form of desensitization that affects both the brain and the body. And if left unchecked, it can become one of the biggest barriers to a fulfilling sex life later in life. The solution isn't to cut yourself off completely overnight, but it does mean diversifying your stimulation. Try reconnecting with fantasy, memory, touch, and imagination. Relearn how to respond to sensation, not just visuals. Give your mind and body time to recalibrate. It takes patience, but it's possible and it's worth it. Now that we've uncovered the 4 most common and harmful mistakes, let's talk about what you can do right. Because when it comes to your health, knowing what to avoid is only half the battle. Up next, I'll show you exactly how to masturbate safely, comfortably, and confidently after 60 and the small changes that can make a massive difference. How to masturbate safely after 60. By now, you've heard the mistakes, and maybe some of them hit close to home. And that's okay. This isn't about guilt. It's about awareness. The truth is, you can absolutely continue to enjoy self-pleasure well into your 60s, 70s, and beyond. But you have to approach it differently. Your body is changing whether you like it or not. That doesn't mean giving up pleasure. It means getting smarter, more intentional, and more in tune with what your body needs. Now, when I talk to my patients about safe masturbation after 60, I don't just hand them a list of do's and don'ts. I talk to them like men who deserve to feel good without hurting themselves. It starts with awareness. Pay attention to how your body feels, not just during the act, but afterward. Are you left sore, numb, or unsatisfied? That's not how it's supposed to be. Pleasure shouldn't leave you in pain. Technique matters more now than ever. Use a lighter touch. Think of stimulation as communication with your body, not a race to the finish line. Take your time. Choose a moment when you're relaxed, not rushed. Your nervous system responds better when you're calm, and your body is less likely to tense up or respond poorly. Lubrication isn't optional at this stage. It's essential. It protects your skin, reduces friction, and enhances sensation in a way that actually makes the experience better. And maybe most importantly, begin to explore what arouses you emotionally, mentally, spiritually, not just visually. As the body ages, the mind becomes an even more powerful source of pleasure. This is the time to reconnect with that. Don't treat masturbation as a leftover habit from your youth. It's still a valid, healthy part of your life. But like anything else in life, it needs to evolve with you. The goal is not just to keep doing it, but to do it in a way that preserves sensation, protects your anatomy, and respects what your body is telling you. And here's the thing. When you treat your sexual health with care and understanding, it has a ripple effect. Better sleep, less stress, more confidence, stronger relationships. These benefits are real, and they begin when you stop treating pleasure like a guilty secret and start treating it like a part of your well-being. Now, before we wrap everything up, I want to leave you with one final message. Something I believe every man over 60 needs to hear. Stay with me. This could be the most important part. Conclusion. If there's one thing I hope you take away from all of this, it's that your sexual health still matters deeply. Just because you're in your 60s or older doesn't mean you have to give up pleasure, intimacy, or connection with your own body. But it does mean you have to be more mindful, more intentional. You're not the same man you were at 25. And that's not a weakness. That's just life. The real strength is in adapting, not ignoring what your body is trying to tell you. We talked about 4 common mistakes: using too much pressure, skipping lubrication, ignoring pain, and relying solely on porn. I've seen those habits show up again and again in my patients, and I've seen the damage they cause. But the good news is that they're all fixable. You can change the way you care for your body today and protect not only your physical health, but your confidence, your relationships, your peace of mind. I've been practicing urology for over 30 years, and I've sat across from thousands of men, some worried, some embarrassed, some in pain. And do you know what they all want at the core of it? They want to feel whole. They want to feel like themselves again. And I tell them, it's not too late. In fact, sometimes the healthiest, most fulfilling version of your sex life can begin after 60, when you slow down, pay attention, and approach pleasure with the care it deserves. You don't need to feel ashamed about wanting to feel good. You don't need to hide or downplay your needs. What you do need is information. Honest, straightforward, respectful information about how your body works now, not how it worked 30 years ago. And that's why I do what I do. Because every man deserves to age with dignity, with health, and yes, with pleasure. So, if something in this message spoke to you, I encourage you to take a small step today. Rethink your habits. Ask your body what it really needs. Talk to your doctor if something feels off. Don't wait until there's a bigger problem to start paying attention. Your health is still worth protecting. Your pleasure is still worth honoring. And your story, your strength doesn't end at 60. In many ways, it's just beginning. Take care of yourself. You've earned it. If you found this helpful, please take a moment to like this video, share it with someone who might need to hear it, and leave a comment below. Whether you've got a question, concern, or just want to say you're taking better care of yourself, your engagement helps more men find the information they deserve. And if you haven't already, subscribe for more honest, expert advice made just for you.